Kirk Nyland, head of neuroscience for Bozuki Group, an American charity that funds brain research, says 13 trials are underway worldwide looking at the effects of metabolic therapies on serious mental illness. Preliminary results have shown a large group of people responding in an incredibly meaningful way. These are people that have failed drugs, talk therapy, transcranial stimulation, and maybe electroconvulsive shock therapy. He says that he keeps meeting psychiatrists who have come to the metabolic field because of patients whose low-carb diets were followed by huge improvements in mood. Results from randomized controlled trials are expected in the next year or so. It's not only understanding of the immune and metabolic systems that is improving. Vast quantities of data are now being passed with unprecedented speed, sometimes with the help of artificial intelligence, or AI, to uncover connections previously hidden in plain sight. This could, at long last, bring biology more centrally into the diagnosis of mental health, potentially leading to more individualized treatments, as well as better ones. In early October 2023, UK Biobank, a biomedical database, published data revealing that people with depressive episodes had significantly higher levels of inflammatory proteins, such as cytokines, in the blood. A study last year also found about a quarter of depressed patients had evidence of low-grade inflammation. This could be useful to know, as other work suggests patients with inflammation respond poorly to antidepressants. More innovation is underway. A number of researchers are exploring different ways of improving the diagnosis of ADHD, for example, classifying patients into a number of different subgroups, some of which may have been previously unknown. In 3 separate announcements in February 2024, different groups announced the discovery of biomarkers that could predict the risks of dementia, autism, and psychosis. The search for better diagnostic tools is also likely to be accelerated by the use of AI. One firm, Cognoa, is already using AI to diagnose autism in children by analysing footage of their behaviour, sidestepping the long waits for clinicians. Another outfit, the Quantitative Biosciences Institute, or QBI in California, has used AI to create an entirely new map of the protein-protein interactions and the molecular networks involved in autism. This will greatly facilitate further explorations of diagnostic tools and treatments. All such developments are promising, but many of the field's problems could be resolved by relaxing the distinctions that exist today between neurology, which studies and treats physical, structural and functional disorders of the brain, and psychiatry, which deals with mental, emotional and behavioural disorders. Dr. Lennox finds it extraordinary that the treatment options differ so completely if a patient ends up on a neurology ward or a psychiatric ward. She wants antibody testing to be more routine in Britain when someone presents with a sudden post-viral mental illness that doesn't get better with standard treatments. Thomas Pollack, a senior clinical lecturer and consultant neuropsychiatrist at King's College London, says MRI scans should probably be used on patients after their first episode of psychosis, as in 5 to 6% of patients, it would change the way they're treated. This rift between neurology and psychiatry is greater in Anglo-Saxon countries, says Dr. T. Bartz van Elst. These are countries including America, Britain, Canada and New Zealand. In Germany, psychiatry and neurology are more integrated, with neurologists training in psychiatry and psychiatrists doing a year of neurology as part of their training. That makes it easier for investigational work to be done. He says he offers most patients with first-time psychosis or other severe psychiatric syndromes an MRI of the brain, an electroencephalogram, lab tests for inflammation, and a lumbar puncture to find evidence to support different treatments in some patients. The price tag, around €1,000 or $1,070, is no more than the cost of hospitalising a patient for 3 or 4 days, says Dr. T. Bartz van Elst, so maybe good value for money. All this work will one day put psychiatry and its patients on a firmer footing. It's already offering validation for some of those for whom the field has failed. Jessica Whitson is only one of them. Diagnosed and treated too late, she still struggles with her condition, and her future's uncertain. Those with ME/CFS, a post-infectious condition which comes with a series of cognitive problems such as attention and concentration deficits, were once dismissed as malingering or diagnosed with yuppie flu. New work suggests it's associated with both immune and metabolic dysfunction. Some wonder whether these conditions are the tip of a much larger iceberg. The prize in finding out more will be better patient care and outcomes. Biology is coming, whether psychiatry is ready or not.
Thank you for listening to Editor's Picks and for being an Economist subscriber. We'll see you back here tomorrow.